Hello, everyone, and welcome to Decoding Application Systems, the future of health information management. I'm Amanda, your host, and I'm thrilled to take you on an exciting journey into the world where artificial intelligence and health information systems converge to transform healthcare as we know it. Today, we are not just talking about theories. We are diving into the real impact of cutting edge technology and patient outcomes, policy shaping, and the advancement of public health. This podcast is crafted for students, researchers, health professionals, and policymakers who want to understand how AI is redefining application systems in healthcare. Joining me today are three experts, each bringing insights from their area of expertise. We have Alex, who is our technical expert. He will explore the nature of application systems, their importance, and the various types of commonly used in healthcare. Faruzian, who is representing the clinical side, she will be discussing how these systems impact clinical operations, patient safety, and data integrity. And Imelda, who is our legal and compliance expert. She's going to address legal considerations and compliance requirements, ensuring that these systems meet regulatory standards. Together, we're here to provide a comprehensive and practical insight, breaking down complex concepts to make them understandable and relative to the healthcare landscape. So let's dive in. We are going to start off talking to Alex, who is our technical expert. Alex, you want to start off?
Yeah, thanks, Amanda, for that warm handoff and introduction. So let's dive into the essentials of application systems in healthcare. They're huge. These systems are foundational to health information systems. And, just to give a brief background, that's going to be, an abbreviated term that we like to use in healthcare called HIS, because they're designed for specific healthcare functions, from assessing patient records to aiding in clinical decisions. One of the core systems that I mentioned is the electronic health record, or EHR, as we say in healthcare. EHRs are centralized patient data sources providing healthcare teams with quick access to complete patient histories, lab results, imaging, and more. This ease access not only improves healthcare efficiency, but also enhances patient centered care. Again, this is one of the biggest changes that we had since healthcare from the past, when we used to do everything by paper. So these electronic healthcare records reduce the redundancies in patient data and support seamless information sharing among care teams. I'm sure everyone knows Epic, one of the biggest electronic healthcare records out there. Because of Care Everywhere, you are now able to, basically have your information viewable at any organization that is using that feature. So, another item that I do want to touch on is this clinical decision support system, or as we like to say, CDSS. So, this clinical decision support system uses an AI algorithm to provide healthcare providers with evidence-based guidance. For example, a clinical decision support system might flag potential drug interactions, suggest dosage adjustments, or provide diagnostic suggestions based on the patient's data. These systems empower providers to make safer data-driven decisions and deliver higher quality care. And so these are some of the essential items that we can use AI in. And finally, we have the computerized provider order entry, or CPOE, and the system lets healthcare providers input medical orders directly, cutting down on manual errors and speeding up order processing. Specialized systems like radiology information systems and laboratory information systems also streamline, management of imaging and lab results to, speed the process up. So to sum it up, this AI generation is very exciting and crucial for boosting efficiency and accuracy in health information management. And I think as we see AI evolve, we'll also see these systems only grow more capable and transformative. But thank you for your time, and let me go ahead. Let me hand it off to Horizon to speak a bit further.
Thank you, Alex. From a clinical perspective, these systems have revolutionized how we handle patient care. We are talking about smarter, safer, and more efficient electronic health records and health information systems. Let's explore how AI makes a real difference in clinical operations, data integrity, patient safety, and workflows. Imagine a world where AI supercharges healthcare operations. It is happening now. AI doesn't just enhance health information systems, it transforms them. With real-time data analysis, clinical representatives make faster data-driven decisions that improve patient care. AI-powered patient portals gives patients access to lab results and medication summaries. By breaking down data silos, AI ensures seamless care delivery and boosts efficiency. Now let's dive into data integrity. AI is not just managing data, it is elevating it. Data integrity is crucial in healthcare, and AI is taking it to the next level. Tools like natural language processing organize clinical notes to keep information accurate and up to date. Machine learning and big data helps detect patterns and anomalies, improving reliability. AI also acts as a digital bodyguard by preventing security breaches. As clinical representative, we must ensure AI systems operate safely, maintaining patient trust and compliance. Patient safety is at the core of healthcare, and AI is taking it to the new heights. AI automates tasks like medication orders and lab results, reducing manual workloads and driving proactive care. According to CTIG, in JAMA 2022, electronic health record safety guidelines are vital for effective use and better outcomes. Safer assessment optimize electronic health records, enabling real-time alerts that prevents adverse events. From drug allergy checks to personalized education, AI helps create a safer healthcare environment. In terms of clinical workflow, AI is a true game changer in clinical workflows. Automates tasks like data entry, scheduling, and follow-up that reduces administrative burdens. It aligns with safer guides by focusing on urgent tasks. AI also minimizes errors, improves communication, and boosts decision makings. Clinical decision support systems is at the core of AI in healthcare, acting as a lifesaver by detecting early signs of sepsis and predicting deteriorating conditions. AI aligns with safer goals, improving outcome by enabling quick, informed decisions and reducing cognitive load. Overall, AI is a revolutionized healthcare with smarter electronic health records, better data integrity, safer patient care, and optimized workflows. It is not just about keeping up, it is about leading the way to safer, more efficient healthcare for everyone. Please continue.
Okay, so now we're going to go into some questions and answers. I'm going to ask a couple questions and see what you guys feel about them. What would you guys say are safer guides?
Safer guides are checklists that help hospitals ensure safe and effective use of electronic health records by identifying safety gaps and improving patient care.
Okay, and then to what extent can AI be relied upon in diagnosing patients' illnesses or recommending a course of treatment?
Yeah, just to go ahead and chime in on that, Amanda. I think it's huge, and we're already seeing that application to this day with predictive um, analysis models of getting notifications that the dosage you're sending is already too high. I think what we have to look out for is, relying too much on technology, and that's a huge scare for providers and healthcare administrators here. You definitely don't want the new generation relying too much on technology, but also this technology is assisting us greatly. So we have to find, that fine line where we are using the technology, but the technology isn't using us. So I think it'll be huge in the next few years to see what comes of it.
Do you think robots will actually take over, like, the full-on healthcare system?
Oh my gosh. You know, it's so funny when we talk about AI because I think everyone goes over to that movie. And I think there's
I
that movie with what's
Is it
the
I,
actor?
Robot?
I Robot. Yes, yes, yes. I mean, we're already seeing kiosks over in the big organizations where you can kind of, do your pre-check-in, and if there's no copay, a lot of times, you can even check in there and just go to the waiting room and see a provider. But I think we're far from that era of the robots taking over.
Okay, so now I think we should hear from our legal and compliance expert. Imelda, would you like to speak on anything?
Hi, you guys. Okay, I actually, you know what? So my on my field experience at Emerald Valley Medical Center, they have robots called Moxies, which they have at least I've seen 8 of them. They deliver pharmacy medications to each floors and laboratories. So there's the ML, which is what multi-language or the big languages. So there goes the AI, but it's still we're still far from they're gonna take over what the human can do. So anyways, let's go to the legal and compliance experts. I'm part of this presentation. So the legal requirements and compliance, so we have to go over the HIPAA compliance, the General Data Protection Regulation, or the DGPR, the high trust certification, and how an organization ensures compliance and security. So when we talk about the EHRS, we have to make sure that when we're dealing with direct patient care, we have to protect their privacy. We always have to protect their their electronic healthcare records and professionals to access real-time patient information, which manage electronic healthcare records and their enhanced communication among the team care or the care teams. For example, AI-powered tools can aid in diagnosing illnesses, recommending treatment plans, and tracking patient progress, ultimately resulting in better patient outcomes. As basic administrative functions, information system facilitate vital administrative activities like scheduling appointments, handling billings, and managing resources. Automated system minimize human errors, boosts efficiency, and ensures that healthcare organization runs smoothly. So, for instance, patient scheduling system can enhance appointment allocation, leading to a shorter time or waiting time, which improve resource use, right? So, in another area for application of the AI is the decision support system, which it's the DSS. This system offers healthcare providers evidence-based suggestion to guide clinical choices. It's an algorithm examine extensive data sets to identify pattern suggestions to guide clinical choices. This algorithm examines the data set to identify patterns that evaluates risk factors, forecast patient results. By incorporating clinical guidelines and patient-specific information, DSS strengthens decision-making, ensuring that providers offer the top-notch care. So let's go to the technical requirements for data retrieval and advanced analytics. For effective extract and analyze data from the information system, healthcare organizations must address several technical needs, such as the interoperability. It is vital for various systems to interact and share data seamlessly, right? So standards like the fast healthcare interoperability resources supports this interoperability system, which it facilitates the efficiency data transfer among different healthcare facilities, such as like Kaiser to the Epic again. The data quantity and the governance. It ensures the data used for analysis is accurate, complete, and timely, and which is essential. Implementing this strong governance practices helps preserve data integrity, enables advanced analytics. So what kind of tools do they use? Organizations should invest in advanced analytics platforms capable of managing large data volumes. Tools such as data warehousing in business intelligence systems, allowing healthcare leaders to visualize data and extract actionable insights. Let's go to the system theory and information management. So understanding the system theory is crucial for efficient information management. System theory promotes the idea that healthcare information or healthcare organizations functions as interconnected system where alterations in one domain can influence others. This comprehensive perspective encourages an integrated approach to patient care, operational efficiencies, and resource management. When you think about the system, this method prompts the healthcare leaders to see the healthcare organization as interconnected system where changes in any area can impact others. It nurtures the holistic perspective of patient care, operational efficiency, and resource management again. When it comes to the effective information management practice, it guarantees that essential data is accessible to decision makers while ensuring security and compliance. Of course, this involves establishing policies for data access, usage, retention to protect patient information. Of course, the continuous advancement of the technology in healthcare brings both challenges and opportunities. A critical examination of these technologies includes telehealth. The growth of telemedicine has revolutionized patient interactions, allowing for remote consultations and enhancing access to care. However, there are some obstacles related to regulatory compliance and reimbursement, of course, with policy remains. And then AI and the machine learning, the capability of AI application to improve diagnostic precision and operational efficiency is significant, offering a promising future for healthcare. Nevertheless, ethical issues concerning data privacy, the algorithm bias, and accountability must be resolved. Leaders must have to navigate these challenges to fully leverage AI potential in healthcare. Now let's go to the decision making of the leadership. When leadership they need to weave health information technology consideration into their strategic decision making. So when how organization ensures compliance, safety, data encryption, they have to really get into the encrypting PHI, both rest and in transition, access to control, regulatory audits, and training for all employees. With ongoing staff training and data security best practices is crucial for handling data securely. So in conclusion, ensuring legal compliance and robust data security within healthcare information system is crucial for safeguarding patient privacy and fostering trust. Adhering to HIPAA regulation, meeting the GDPR requirements for international patients, and obtaining certifications such as the high trust showcase a strong commitment to protecting sensitive health information. Essential measures including data encryptions, role-based access controls, regular audits, and ongoing staff trainings are vital for mitigating risk and ensuring compliance with evolving legal and security landscape. These practices are foundational to success and integrity of healthcare organizations. Thank you, guys.
Thank you guys. Thank you all for joining the podcast today. It was very interesting speaking with all of you, especially on a topics like artificial intelligence and with how robots are taking over the world right now. So it was very good to talk to all of you guys, and thank you for joining.
Thank you, Amanda.
Thank you so much. It was very nice to be here, and I appreciate everyone here.